Good afternoon, and thank you for joining us at Chatham House for this discussion focused on prospects for advancing global health priorities through global governance fora. This is really about international funding for global health priorities is tight, with many believing that it's probably going to need to focus on global public goods. But which? Which truly need international financing and which global health priorities need more domestic financing? But our discussion is really of the international part. How are these going to be paid for? There's a focus on pandemic prevention, preparedness, and response in this panel, as that's one of the global public goods that's at the top of the political agenda right now, especially with the establishment of the pandemic fund at the World Bank coming out of the G20 this year, and the hopes and fears for that. But even though we have just experienced and are still experiencing the all-round devastation of the COVID-19 pandemic, and despite the global health community saying that if this doesn't convince the international community that funding better prevention, preparedness, and response for the next time is a no-brainer, it's not clear what will. It seems that while it might be a no-brainer on public health grounds, it's not actually a no-brainer in political terms, because initiatives seeking to address this problem with donor funds are struggling to get the financial commitment they're asking for. And there's a lot of wondering about why these priorities aren't getting the traction and international financial flows hope for. What would it take to get the traction necessary, and whether there's a better approach altogether? With me to discuss these issues today are three eminent panelists with heavy-duty experience in the field. We have with us Priya Basu, who is Executive Head of the Pandemic Fund Secretariat at the World Bank, Rashir Agarwal, a co-founder of the Global Talent Lab and former head of the Global Health and Pandemic Response Task Force at the IMF. And from the G7 donor perspective, we have with us Agnès Sucat, Director of Health and Social Protection from the French Development Agency. So welcome to all my panelists. Before we are going to go into the discussion, I'll just give a bit of housekeeping, and the main one is, obviously this is not under the Chatham House rules since this is being publicly webcast, so please do feel free to tweet or whatever it is you'd like to do to spread the word. If you would like to ask a question, we will be doing a Q&A exchange with the panelists. Please write it in the Q&A function, not the chat function, and if you see a question you like, please upvote it, because I tend to kind of see the popularity of the question. You'll be more likely to be asked if you upvote a question if you have one similar. Without any further ado, I'm going to move on to the main discussion now. Priya, I'd like to open with you. You've got quite a tough job at the moment with shepherding the pandemic fund. You've got critics bemoaning the fund as an outdated and opaque model, already writing off its potential influence and impact, but it is a vehicle that many are hoping can be the focus of activity in this area. And I have three basic things I was hoping you could tackle at the outset of this discussion. One is, how are we going to get the money into the fund? I think you're at about 1.5 billion on a 15 billion ask. That's dollars, if you correct me if I'm wrong, of course. And with pandemic prevention, preparedness, and response globally having a finance gap of about 10 billion a year, it seems such a daunting task to get the money in. And secondly, I know it's early days, but there are a lot of people hoping it could be clear by now what the money is going to be spent on from the fund. So the second one is, what's the money going to be spent on, and how this fund fits in with the rest of the architecture that funds activities around this problem. And lastly, to the question of, is this fund going to be the answer, the focal point for the task of resourcing global pandemic preparedness, prevention, and response going forwards? What should we reasonably expect from this fund? So over to you, Priya.
Thank you very much, Emma, and hello, everyone. And it's great to be on this panel. So maybe, if I can just start by reminding us, you can think of it as a glass half empty, or you can think of it as a glass half full. And I think the Indonesian G20 presidency has done a stellar job in carrying forward the work that the Saudi Arabia and Italy started under their respective presidencies to focus attention on filling critical gaps in the international health regulations of 2005, in implementing those capacity gaps, and in strengthening capacity for pandemic prevention, preparedness, and response at the country, regional, and global level. And so, really, this over the past year, there's been a heightened attention to investing in PPR, and the global community really has come together in times where, often we're seeing multilateralism not work. This fund, the pandemic fund, really is a demonstration of multilateralism. And I'm just coming out of the G20 meetings in Bali, where there was a lot of there were a lot of references to this fund really being seen as a significant innovation in global health financing. Now, we've always maintained that this is one part of the solution, the global health financing landscape, and indeed the subset of it that focuses on pandemic prevention, preparedness, and response has many actors. And all of those actors have responsibilities. The multilateral development banks are the largest funders. The World Bank, in fact, amongst them, is a massive funder of activities in pandemic to strengthen pandemic prevention, preparedness, and response at the country level and also at the regional level. But there are other actors. There's, the large Geneva-based global health institutions, Global Fund, Gavi, also STEPI, and they've all stepped up during the pandemic. But this fund, what it does is it has kind of a unique value proposition. It is the first ever fund that is focused entirely on pandemic prevention, preparedness, and response. And the goal is to bring dedicated long-term financing for, let me use the acronym PPR, to low and middle income countries. It's kind of the big goal is to leverage to bring external financing. But also, for every dollar of grant financing that the pandemic fund will provide to low and middle income countries, it also kind of seeks to incentivize those countries to prioritize the agenda and to increase their own levels of effort towards PPR. So you referenced some numbers, Emma, at the beginning. So one of those was a report that I co-authored with the WHO for the G20 earlier this year, which estimated that the pandemic financing gap is about $30 billion per year for low and middle income countries, of which about 10 billion needs to come from external financing and about 20 billion from domestic financing. So for every dollar of grant money that we provide through the pandemic fund, we want to incentivize countries to put in their own investments. And of course, the level of effort will depend on the income level and sort of the fiscal constraints that the countries themselves face. But for middle income countries, the hope and the expectation is that they will put in a significant amount. And then on top of that, for every dollar of grant funding that we provide through the pandemic fund, we expect our implementing partners in this fund, which are the MDBs, 3 UN agencies, and other global health institutions, to also co-finance. So the whole will be larger than the sum of its parts here, and that when we look at how much we've raised so far for the pandemic fund, we expect to get much more out of every dollar that we provide through the co-financing that comes from international partners, as well as the financing that will come from low and middle income countries themselves. Now, you asked about the what, and this is something that we're actively working on right now. The board of the Pandemic Fund has set up 3 technical working groups, and one of them is focused on what the first call for proposals should focus on. But more broadly, the priorities, as we've set out in our various founding documents, are kind of 5 areas that we believe are really important to strengthen pandemic prevention, preparedness, and response capacity of low and middle income countries. And those are: 1, integrated disease surveillance; 2, laboratories; 3, health workforce strengthening. And when I talk about public health workforce, I talk here both about frontline workers, but also those who are involved in surveillance and labs and, building field epidemiology epidemiological capacity. So, across the board, public health workforce. Fourth, community engagement and coordination. I think we all saw that communities played a really important role during COVID-19, but also in other pandemics. And how can we strengthen the capacity of communities to sort of help with surveillance, but also other functions. And then lastly, emergency coordination and management, kind of a whole of government approach. What needs to be done to ensure that countries have the capacity to be able to work together in a coordinated manner. And that really doesn't require that much money, but it requires some legislation. It requires, kind of reforms that allow different arms of government to be able to work together. So, just in terms of very, very briefly, we do believe that this, if there ever was a case for the world to come together around a global public good or to tackle a global public bad, this agenda, this PPR agenda, sort of presents itself in a very compelling manner, and that the very nature of pandemics are a global public bad. So I don't think there is much debate around whether or not this is a global public good. It is. Every dollar that we invest in strengthening PPR capacity, wherever that might be, will help the world become safer. We've all seen the massive, toll that the pandemic has taken, but we've seen past pandemics as well, both in terms of, lives lost and in terms of the economic costs. So every dollar we invest now will not only help save lives in the future, but it will also help save resources in the future. And this fund, I would again say, yes, we've raised $1.5 billion so far, but there's more coming. Just last week at the G20, we had Saudi Arabia announce at least 50 million. We had new contributions from Australia. We had existing donors topping up. So I'm optimistic that the world, it has already come together, and it will continue to support this agenda. I think the Indian G20 presidency also has a strong focus on this. Their mandate is One Earth, One Health, One Future. So I'm optimistic, and I would just say that lastly, what was very good to hear at the G20 was that leaders were very much behind the basic structure, the basic governance and operational arrangements that have been set up for this fund, which many said set us up for success. An inclusive and agile board. It's one of the few boards that actually does have equal representation of donors and potential recipients, what we call co-investors. It has flexibility built into it. We can, this is not a new institution that's kind of trying to crowd the global health architecture. It really is a fund that seeks to work through existing institutions. So it has the flexibility to channel money through a number of key players in the global health and PPR space. Providing complementary financing, coming back to the original point, helping to use the grant money to leverage more resources for PPR. And lastly, that it is built on, strong principles of transparency and accountability. So I think we've set ourselves up well. We have a daunting agenda, but I think there are grounds for optimism.
That does sound much more optimistic than when I was looking into the way people are feeling about it. So I hope that you did get a lot of great traction and feedback in Bali. So and that's very, very fresh. So it's good to hear that it's going well from that standpoint. Ruchir, I want to bring you in now on what your perspective is on what has really been achieved. So looking back maybe over the since the pandemic has hit, and also you recently made a move from out of the IMF, but you were there during the pandemic. So what do you think the G7 and the G20 have done of true substance to progress funding for global health priorities since the pandemic has hit? but also among the global health priorities that are on the agenda, do you think that PPR, the Pandemic Prevention, Preparedness and Response, is getting relatively more traction than anything else? Because there is a long list of priorities. There's UHC, there's the high-level meeting on tuberculosis, there's always antimicrobial resistance lurking in there. But do you think PPR really is getting the traction, more so the top spot? And therefore, kind of linked to that, what do you think the prospects are for advancing the international portion of the funding for this work through the G20 and the G7? And perhaps give us your perspective of how the IMF's own new fund, the Resilience and Sustainability Trust, which was also set up this year, might fit into this whole picture. Thanks.
Thank you, Emma. Thank you. I'm very glad to be here and joining Priya and Agnes as well. So on your first question on what was achieved by the G7, G20 on the pandemic side in the last 3 years or so, I think what we have seen is an unprecedented collaboration. So yes, the global response was imperfect. Yes, things could have been done much better, but still the degree of cooperation that we've seen across G7 countries and G20 countries is unprecedented, and we must welcome that. The challenge for us going forward is really how can we take that formula to work together and still retain the good elements of that once the pressure of the pandemic starts easing. So just to give you some numbers, you know, if you look at the donor countries, most of them were G20 countries and large subset of that G7, to the ACT Accelerator, which is the consortium of agencies that came together to fight COVID. They received, you know, about $21 billion in grant funding from the donor countries, and that's very large. That's a huge amount compared to what the annual giving of these countries are for humanitarian or development purposes. They also, the G7, G20 countries also donated about 1.5 billion doses in vaccines. And, you know, in some countries, that's like one vaccine. As computing it for Spain, it was more than one, you know, vaccine per citizen. And so it's like each citizen basically has effectively used the tax money to donate these vaccines to the low-income and middle-income countries in a difficult period. And I think that's something we must welcome and find ways. The challenge for us is how can we keep coordinating and keep collaborating with a bit more formal structure with the right people around the table, not just kind of we had to do it from an ad hoc perspective during the pandemic. So point one, a lot was achieved, and our challenge is keep that ability to work together going forward. Second, on your question on you know, what is left to be done really. In the PPR agenda, I would say if you think about what PPR stands for, pandemic prevention, preparedness, and response, in a big chunk of the pandemic fund, as I understand it, is really focused more on financing for the preparedness and prevention part. We still need a lot more work to be done on having a centralized pool of money to fund the response in the event of the next pandemic. So this is what I call day zero financing. And effectively, what we know from the pandemic, the COVID pandemic, was the timing of funding matters a lot. And we still need to do a lot of work to make sure that there is a pot of money available on behalf of developing countries to facilitate a large, quick and efficient response, which we were not able to do during the pandemic. And just give you one idea of what that means is, if you think about COVAX, which was the entity responsible for raising money and channeling those funds for vaccines for developing countries, they raised roughly $10 billion by June of 2021. But if they had raised the same amount of money about 12 months earlier, we would have had a very different response for the developing countries, because the timing of when the developing countries got access to vaccines could be different. We may not have seen so many new variants emerge. So I think timing matters a lot, and still on the incomplete part of the agenda, we need to really zone in and think hard about that day zero financing and the response side. Now, a footnote to this second question on kind of what remains to be done, that's PPR. We also need to do work on, as you said, Emma, on the universal health coverage issues, and still fighting COVID, which is still in a way, we're still towards the end, but still work needs to be done. And given that we are in a difficult financing situation globally, there needs to be a lot more conversation across these three parallel fundraising exercises, because there's a lot of room for complementarities, and there are a lot of multipliers from each dollar spent, as Priya talked about. So the more we can build a universal financing framework that builds on these complementarities, the more each dollar, the farther it can go. So that's kind of on, as I see it, on what needs to be done. And the third question really on I want to kind of emphasize this very strongly, the logic of financing for pandemic prevention, preparedness, and response. The logic is very different than humanitarian assistance, because by preventing a pandemic, which can start in any country far away from you, you also benefit from that, because not the country just where the pandemic may emerge, but you are protecting, you're being protected, your economy and your population are being protected. So we have to start thinking about pandemic financing as more of a systemic risk issue, not simply a development issue, which it very much is. And because of that logic, the responsibility, it's also in the private interest of rich advanced countries to put money at the table and bring the coalition of actors together to solve this problem, because it's not simply from the goodness of their heart, which it very much is, but also it's in very much in their self-interest. And just to give you a number, if you think about the economic losses during the COVID pandemic, the IMF had estimated at the beginning of this year that the cumulative losses from the pandemic up to 2024 was about $13.5 trillion to the global economy. In a single year, the global economy GDP is about $100 trillion. So that's a very, very large amount of money. And so we have to start thinking about this problem from a systemic risk perspective, and not just thinking about funding it through the standard ODA, the official development assistance type of funding, because this needs to go beyond that. And I think, in my view, the pandemic fund is an important actor there, but it cannot be simply a pandemic fund solution. That's one solution, as Priya said, out of the entire architecture. More we can bring in the financing side of things to the health side of things and have such conversations like we're having now, the better we can make progress on this, especially in an environment of limited funding. So let me stop there. Or maybe you had one thing on the RS. Perhaps since I've spoken for so long, I'll come back to the IMF Resilience and Sustainability Trust. But one simple sentence on that is the logic of the IMF's Resilience and Sustainability Trust is exactly this, is to help countries deal with longer-term sustainability challenges that can help prevent external shocks. And it's a complementary source of financing that adds to that landscape of financing to help countries build resilience on health and climate issues. Those are the two priorities there first. We can talk about it more in the Q&A afterwards. Let me stop there. Over back to you, Emma. Thanks.
Thank you, Rashir. And both you and Priya have thrown up a lot of follow-up questions. I'm like chomping at the bit to restrain myself until Agnes has weighed in, and then I do want to follow up on quite a few things that have prodded me on that. But Agnes, I'd love to hear from you now as to what you think are the prospects of global governance fora such as the G7, G20 being the focus of international funding for global health public goods. I mean, especially as Rashir just said that, you know, we can build a universal financing framework. I mean, I immediately thought, who's we? Who's going to do that? How can we do that? So, I mean, are these fora a good place to focus this on? And if so, to what degree? And why do you think that? And then secondly, which of these global health public goods have the best case for being the priority for international funding? And I know we'll talk more about domestic financing versus international, because there is a bit of a, rabbit hole of, donors should, fund everything on this. But, I would love to hear from you as to what that balance should be, and we'll talk more about that. But which of these public goods do you think can make the best case for international priorities? Because there are so many vying for attention. And maybe you think there is room for multiple of them, but from what we're hearing is there needs to be a bit of simplification and prioritizing in the ask. And maybe part of why these things don't get traction is because there's so many being asked for, and it's not clear the case isn't being made properly for them. So Agnes, your thoughts on those?
Thank you very much, and thanks for organizing this. I think it's incredibly important to have that conversation, which has started during the pandemic, but is slowly crystallizing and getting us on I think a very promising pathway. The first thing that we need to say is when we talk about public goods and common goods that address market failures, if we go to the global level, we're talking about global market failures, and that's what we are trying to address, and functions that cannot be fulfilled by the private sector. And here we have one major weakness, which is we don't have a global government, because typically the way societies have organized themselves, and this culminating in the 20th century, is by developing modern states, institutions that generate collective financing and generate institutions that handle the financing of those public goods and the regulation of the market that address those market failures. So when we talk about global market failures and we talk about global public goods, then we face the question of who is the government. And the closest we have today to a global government is of course the UN system, and attached to it the financial institutions, including the World Bank and the IMF, but those relating to a broader network of public finance institutions that are the public development banks. And typically, public investments, most of the public investments today, including public investments in health systems and in PPR, come from government budgets, and either through the regular budget funded by taxes, but also through the investment budget and deficit financing that comes from borrowing, either borrowing on the markets or borrowing from public development banks. And for poor countries, for low and middle income countries, low and low middle income countries, the option to borrow from markets is quite limited. So when they want to increase public spending beyond what their tax base can do, then they have to rely on public development banks. And I think that's one of the merits of the creation of the pandemic fund now at the World Bank, is to acknowledge that, all countries already invest in PPR, they have a role to play, but understanding that there is a global public good component to these investments, so that countries need to be supported, they need to be incentivized, and they need financial support to soften the financial burden of these investments, and to introduce this element of global solidarity, because it's a global commons, and because investments at country level are a common good, so that there need to be a common pot at global level that supports the investments in those global goods at country level. And in this sense, the pandemic fund is well designed and very promising, because it establishes that global pot at global level that provides the incentive to countries and the support to countries. And in this sense, it's probably one of the most promising global health instrument that we've seen so far, because it articulates with the country investments, it articulates with the the capacity of public development banks at national, regional, and global levels to support countries to invest. And it has really this financial infrastructure that is in place and that is serving the countries. During the pandemic, one example, Afrexim Bank in Africa supported the AVAT mechanism and was very quick in responding to the demand of African countries to finance vaccine, and has learned a lot from the epidemic, from the pandemic, now proposing to help countries invest in health systems and developing programs that propose to fund projects investing in health systems at country level. CAF in Latin America, same thing, mobilized a very large amount, hundreds of millions of dollars to support countries purchasing vaccines. So we've seen a response of the financing architecture during the crisis that should not be left to waste, but should be continue to be mobilized in the future for investments in PPR as the step zero of investments in health systems. And let me give you some numbers to make it clear. I mean, all development aid in 2019, and it was probably the same in 2020 from early numbers, was 16 billion at country level. You just heard that the cost of the pandemic was close to 10% of global GDP, which is more in the 6 trillion. And what development banks altogether mobilize per year is 2.7 trillion. So if we would only galvanize this financing capacity of public development banks to support countries in their domestic framework, in their domestic investments with the support of the pandemic fund, we could mobilize maybe 10% of that pot. That would be 270 billion. So more than 10%, more than 10 times what we spend today on development aid for health. It's a completely different order of magnitude. And I think it's really time to recognize that grants are just too small to get us to the objectives that we set ourselves collectively, whether it is through this movement to strengthen PPR or further down to reach UHC or progress towards UHC by 2030. We need a different framework that mobilize finance and public investments towards the health sector, because often these public investments do not flow to the health sector because countries have other priorities and they borrow for other investments, or they prefer to fund other investments. So there is really the need to together develop that global agenda. So what does it mean? You're saying what should be funded? This is where we really need to clarify what we call global commons, what we call global public goods and global commons. Priya mentioned the most important ones, the priority ones, but we have to realize that that it's not always recognized. That ACTA, for example, when we read the independent evaluation that was conducted, really focused on products. And there is always the sense that global public goods are products, but there are other global public goods that are as important, if not more, and some of them are incredibly essential, and that's all the surveillance capacity, particularly the One Health integrated type of surveillance that allows countries to understand what are the health threats, not only biological, but also physical, chemical, environmental. So we need to strengthen those public health institutions at country level. It is a global public good. And of course, attached to that, the lab capacity, or the technical capacity that allows that surveillance, particularly when there are outbreaks, but not limited to that. We also need to have surveillance capacity before the outbreaks are there and are able to understand what are the dynamics of health threat. The question of regulation has been really highlighted, had come to the fore during the pandemic, with the question of sovereignty and production of products, and in order to be able to have production of products, of medical products, vaccines, medicines in low and middle income countries, we need to step up the investments in regulation agencies so that you have the enabling environment for that production. And then, of course, an architecture, a basic skeleton of a health system that allows prevention and response is essential, including those One Health programs, animal health, environmental health, that need to be invested in. And this is this global public health architecture that failed during the COVID-19 pandemic, that we need to invest in. And certainly what is really exciting with the pandemic fund is the fact that it is related to the entire architecture of financing, not only to the limited amount of grants that are available in global health, but is really be able to link it to domestic investments, regional investments, and more generally, the question of public investment. Is there something to improve in that pandemic fund framework? For sure, because the key question is actually the source of revenue. Because again, we don't have a global government per se, so we don't have a global treasury. We don't have a steady, sustainable income source for that pandemic fund. And here comes back the question of global taxation and the possibility of thinking about a global tax, whether it's a financial transaction tax or airline tax or a carbon tax that would be able to fund these different pots of subsidy for incentivizing investments in common goods. And it should not be only for health, of course, it should be also for climate and other global commons that we need together to fund if to be able to prepare ourselves and face the future challenges that are coming our way with climate change and biodiversity loss. Thanks.
Okay, thank you, Agnes. So instead of asking my questions, because I have so many of them, I just wondered whether any of you lot would like to weigh in on what any of the others have said, because I see some nodding and kind of thoughts percolating like those bubbles, and they may have gone now, but I just thought I'd open it up to you to discuss amongst yourselves if you want to come back on anything any of the others have said. Well, I'm going to actually I'm going to go to questions because we have at least 14 questions, and I'm going to go to the one that's top of my list because I think only just now as the upvoting started. This is, now it's been supplanted. Anonymous attendee, unfortunately. How will the pandemic fund incorporate the lessons learned from the Act A? How will it also defy the growing consensus amongst governments that the pandemic is over and therefore reducing political will to contribute to PPR funding?
All right, well, I guess that's for me.
Yes.
COVID was, of course, it's fresh in our minds and it's still not over, and there's lots of lessons from COVID, but there's also lots of lessons from past pandemics. I mean, from avian influenza and SARS and MERS and Zika and Ebola. And I think the one big lesson that we've learned from all of these pandemics is that that pandemics generate panic, but then there's neglect after. So I think the one big lesson that we're kind of quite determined to sort of keep front and center is, let's not fall into another cycle of neglect in inter-pandemic years. Let's keep the political momentum going. Let's keep the momentum at the global level as well as at the country level. And that's what this fund is trying to achieve. It is trying to make sure that in these years, and when you talk to the WHO, they tell you it's not a question of when the next pandemic is going to occur. It's not a question of if the next pandemic, it's a question of when. And the next pandemic may be just around the corner. And so let's use the time now with urgency and a sense of purpose and do what we can to build that capacity. And again, as I mentioned, there's capacities at all levels. There's capacities that need to be built at the country level on surveillance and labs and workforce and community engagement. There's also capacity at the regional level, and I think Agnes referred to this, that one of the lessons from COVID is actually, at the regional level, some institutions did step up and did a very good job, and I think Africa comes to mind, Africa CDC, AVAT, Afrexim Bank. What can we do to sort of build capacity at the regional level? And I think there some lessons around investing now in vaccines, therapeutics, diagnostics, other critical medical countermeasures at the regional level, so that that capacity then exists for the next pandemic. And there I'd maybe slightly sort of refer to take the point that Ruchir was making, and maybe slightly disagree, which is that the pandemic fund is not, it's about preparedness to be able to respond. And the more you invest now, the less you will need to spend on day zero. So, if you have, the capacity in place, if you've already prepared for, the financing that countries need in order to be able to surge up, whether it's, surge in workforce or whether it's surge capacity for medical countermeasures, the more you prepare now, then the less you'll need later. That doesn't mean that you won't need money on day zero, but I think one of the big lessons from COVID was that, a lot was needed on day zero because so little had been done in advance. So just wanted to kind of make that point. And there were several reports that came out of COVID, independent reports, including ones by the high-level independent panel, which is in fact the first one that proposed that a new fund be set up at the World Bank. But there's also the IPPPR report with Helen Clark and others, Ellen Johnson-Sirleaf, and all of them, I think, concluded that when a crisis does occur, then kind of post-crisis financing does start to become available, but then people forget, and the crisis is over, or at least, much of the world, is out of the crisis, and then, investments get neglected. So that is my one big message. And I really, do hope and expect that this pandemic fund, that we've set up, hosted at the World Bank, is going to help us stay focused on this.
Okay, thank you for answering that. I'm going to take the next two most upvoted questions together because I see them as related. There was a third one that Agnes answered, by typing, but they're basically about primary healthcare, universal health coverage versus or included, or what's the relationship there. And this one is from Lakshmi Balaji, and this is: resiliency comes through strengthening systems, particularly those that are closest to the community. Primary healthcare during the ongoing pandemic has been seen to be very weak in most LICs and LMICs, leading to disruption of essential public health functions. So to what extent will the pandemic fund strengthen and bring about true resiliency of primary healthcare? And the related question, I think, is from Robert Yates, and that's: do you think there may be a danger that multilateral financing for PPR might crowd out domestic public financing, which is likely to be more effective? I mean, maybe you could take issue with that, and more efficient in strengthening public health systems. So I guess it's that whole piece about PPR and the underlying systemic thing and how those all knit together. Ruchir, do you want to take that first? I know part of it was directed about what the fund will do, but if you
let me start with Robert Yates's question. I think it's a very, very important point that he is raising. It's really important that the funding that we're talking about for pandemic funding, let's call it PPR, is not crowding out the other sources of funding. So for that very reason, what we at the IMF, our co-authors, also Priya and others have emphasized is all of this financing should be complementary and not substitution. And one way to make sure that happens is if you take the official development assistance that donor countries provide to developing countries, that's roughly, last year it was roughly $170 billion, of which about 20 billion or so was classified as COVID support. What we would want to happen is that COVID support should be separate, or support for pandemic type financing, which is for global public goods, should be treated separately, classified separately, because as I said earlier, the logic of why you're supporting that is very different than humanitarian assistance. So that's kind of point one. On the resilience and the health systems, agreed very much that a lot of work needs to be done on health system strengthening. And exactly as you saw, the focus on products, as Anya said, was useful at some point, but then the last mile delivery problem for vaccination, for example, could not be solved without having that strong health system. Now, that kind of work that needs to be done ahead of time, and it's a longer term challenge. You cannot solve that problem very quickly overnight. You cannot build the roads and have local training, trained staff. Now, since Priya did raise a point of difference, so just in the interest of a healthy debate, I just want to say, yes, Priya, fully agreed that providing funding for pandemic preparedness and prevention, which are very, very important. Prevention may be the most important, actually, because you don't actually ever end up in that bad state of the world. All of that investment can reduce the amount of funding you need exposed once a pandemic begins, but it's not sufficient. You still need a separate mechanism to fund that. And what I was emphasizing about the day zero financing, as I see it, is very separate from the pandemic fund, because what that requires is an agreement between the big governments of the world on how much financing will be provided, at what will be the modality of that, who will have access to it, and what will those things fund. This is actually what the ACT Accelerator did when the pandemic began, in an ad hoc way. What the logic of what I'm trying to propose here is, we should be thinking about the governance and the financing of those issues ahead of time, and be ready to face the next big pandemic, whenever that may happen, 10, 20, 30 years from now. That's separate from what the pandemic fund is doing, which is doing the peacetime financing ahead of time. Lastly, since I want to address one thing that Anya said. It was very interesting, your perspective that you think that we don't have a global government. Actually, I would say we do very much have. You worked in the UN system yourself, and we all did. And in a way, the way I think about it is, we've inherited a system after World War II of global governments cooperating and thinking about pooled financing. But the nature of the problems have become more and more global in nature. The very fact that we're talking about global public goods today, the size of the shocks that are coming from global public goods are bigger. So as I see it, we don't need necessarily a new government system, but what we need is more creative ways for people to work together. And if you think about what the G20 Joint Finance and Health Task Force is doing, that is a creative way of bringing together in the room health ministries and finance ministries that were not talking to each other before. Even on this panel, we are people from the finance side and health side coming to this conversation together, from the private sector. And the more we can have these kind of conversations and find new modalities to work together, I think the better we'll have a chance to solve this problem. So I'm a bit more optimistic, and I have more faith in the system, because I see that as a creativity challenge that we can and will solve. And
yes, do you want to come back on anything, or Priya, on anything there?
Well, maybe I can just quickly, so I fully agree with Ruchir's point in response to Robert Yates's very good question. And I do want to emphasize again that that is why it is precisely to prevent any risk of multilateral financing crowding out domestic financing, precisely to prevent that risk, that this pandemic fund has been designed to kind of work in a complementary way. So, when we come down to the nuts and bolts of how we finance the projects that we will finance, we will require, each project to demonstrate that, it is using the multilateral grant funding that we provide to crowd in resources from other multilateral institutions and from the domestic domestic resources. So this is something that we will really keep front and center, and we're very committed to. That's the only additional point I wanted to make.
Thank you. I'm going to take two more questions together, and I'm going to ask Agnes if you can come in first on this, and then the others. And it's really about Ruchir's point around the framing of a PPR financing not as a humanitarian thing. So I'm going to wrap three round together. So one is anonymous attendee. I don't know if it's the same one. Apologize if the same person's got two questions. Bit naughty, but anyway. But I think it's a good question. And this is on Ruchir's point around framing PPR financing as a systemic risk issue that is in country self-interest. How can that be done in a way that doesn't undermine anti-oppression efforts to stop narratives that prioritize people's lives in high-income countries over low-income countries? And I think related to that is a question from Paul Williams. How do we make investments in PPR akin to investments in military capacity? In the latter case, governments seem happy to invest in the latter capacity, but seem more reluctant in PPR, and why is that? And my related question now to you all is PPR currently seen more as a humanitarian issue? Is that one of the reasons why it's not getting as much traction as it is? Or to what extent is it seen as enlightened self-interest or an insurance policy or a systemic risk from a systemic risk standpoint? And to what extent do these framings matter in getting, whether it's domestic or international money, into this problem? So
thanks. And I think these are fascinating questions that go back to that question of a global government. And in fact, I think we do agree with Russia that yes, the UN and the financial system we have around it is the closest we have to a global government, but there are still functions that are missing. And the questions on security are right on target. One of the functions that is missing is a treasury function, is a taxation part. The system doesn't have a steady, sustainable sources of funding that comes from the expression of the collective will of the 8 billion people who live on Earth today. So we don't really have a pot of collective financing that is deeply owned by every person on the planet. So that's one of the weaknesses of this architecture. But I really agree that the question is how to improve the architecture, and it goes much beyond this particular debate, because there are many reasons why the current global government, as in the United Nations, needs to evolve. But that particular question of financing the commons, which is not unique to health, it's very much a question around climate issues, as we know, and the whole question of emissions is really keeps coming back as a core question. And yes, one of the maybe ways we could improve the debate is by linking it to the security issue. By really emphasizing that discussion on commons. And one of the weaknesses of the debate in 2020 and 2021 was to frame it as an issue of access to product and equity of access to products. And that's one aspect of the response, but that's far from being the only one. And the question is not an equity question; it is a commons question. It's a very different different value proposition. Equity is about getting to the last mile. It's about getting correcting differences in distributions of wealth and access. Commons is about what affects all of us and cannot be achieved by market forces. So commons require collective action. They require government. And that's really, I think, where we need to move forward, because so far the way we have financed health in the global health architecture is very much through an equity approach, and very much through an approach that is favoring grants, and that at the end is very, very little as compared to the challenges that we face, and we need to change the way we look at this. If we look at this idea of a global government and framing that as common security and survival issues that require common government functions, then we need to think differently about what each institution is doing. And for the WHO, for example, clearly there needs to be the kind of Ministry of Health of the world, but then it means it would do very different things from what it does today, and it would focus on the normative work and on the questions of knowledge and questions of regulation. And in this case, probably the funding that the WHO has would be enough if it's not acting as an implementation agency, but it really focuses on the core government function of regulation. So that's the kind of issues that will need to be considered again and again. And I would really fully agree that the G20 in this respect now is an excellent platform, because it's inclusive of the countries that represent most of the world population, and that's a very, very good way that the global community has found to have a conversation that is inclusive of the majority of the world population. But maybe to conclude on that, I think that the question is really that change in framework. And as an example, I mean, there was the fungibility question. There is fungibility today. All the work that has been done over the past 10 years on looking at spending on health shows that there is massive substitution of domestic funding by development aid for health. So in fact, the consequence of grants is substitution and crowding out of domestic financing. So the question is not the eviction, the substitution from one aid pot by another aid pot. The question is how you link grant financing to domestic financing and investment financing. This is how you use the 16 to 20 billion of grants that come for health today, how you use that to leverage the potential 270 billion of public investments that can be done by countries as part of their domestic financing framework. So how do they prioritize those investments in the global commons?
Thank you, Agnes. And unfortunately, we've run out of time, but I am going to ask you all for your parting shots, like one-liners, to give you a last opportunity for a kicker before we go out the door on this. But before that, I just want to thank you all for your insight and perspective on what we think is a really important issue with a lot of considerations, and that is at a potential turning point here with real opportunity to get this right coming out of the pandemic. So before I ask for your one-liner take-homes, I also wanted to just give a shout out and thank the Bill and Melinda Gates Foundation for funding this work that we're doing at Chatham House on the political traction and financial commitment for global health public goods, because I think it really is a conversation that needs to be had. There's a lot to work through, and even in understanding why things aren't working the way they are now, and how do we move forward with this in a better way. So with that, I'm going to ask each of you for a one-liner. And if you've worked with me before, you know I'm quite strict about, I mean one-liner, as to what your key take-home is for us to think about on this issue, and then we will close this session. So Pri, I'll start with you. I won't go in the order we went originally. One-liner.
Sure. So I really do think that investing in pandemic prevention, preparedness, response is a collective responsibility. It really is a shared responsibility, and it is absolutely vital to keep the focus on this. Thank you.
Thank you. Okay, Ruchir.
Thanks all. My one-liner is pandemic policy is economic policy that we should finance from a perspective of systemic risk and global security in an inclusive way.
Thank you. That's very clear and succinct. Agnes, you've got a challenge to match. Go ahead.
Well, my one-liner would be that investing in public health institutions at country level is a global common, and it will benefit all of our global health objectives. It's really the first step towards UHC.
Thank you. Those three take-homes were very advocacy-ish, but I don't expect anything less from all of you to advocate for better public health and security for all of us. So thank you all again for joining us, and thank you to the audience for tuning in. And there will be a recording of this for anyone who wants to catch up or dig deeper or listen to again. So thank you very much, and have a great rest of the day.
Thank you.